Chemotherapy and radiation, the standard terms used to describe the most common treatments used in cancer. And I think they can be very good and very helpful in early stage disease when people are first diagnosed and maybe the tumor's removed by surgery, and then those other therapies are used kind of prophylactically to help patients have a better remission rate, right? But what about late stage and complex cancers? I want to introduce you to GTFC, genetically targeted fractionated chemotherapy, which is the really next level of treatment. It's just not chemo, just not radiation. How? Chemotherapy is typically designed from what's called NCCN guidelines. About 28 or 30 top cancer centers and hospitals around the country come together and decide what protocol everybody's going to get, except for one problem. All those protocols change. Why? Because everybody's genetics are different. Their cancer genetics are different, and those mutational changes are different. And unless you base the care on that, you are literally, in my opinion, in our clinical experience at Envita, 7 to 10 years behind the work that we are doing to help our patients today. So when you have the right targets, you're able to treat that patient's cancer. You don't have to use as much chemo. That's why we call it genetically targeted, fractionated. The word fractionated means low dose, microdose chemotherapy, because at that point we don't need to use as much because we know our targets are spot on because we use advanced testing, some of the world's best testing, far different than any typical genetic test that you may have seen or is currently available from a biopsy, for example. So that data allows us to pinpoint the treatment. With that, in the GTFC, we're able to not only give commercially available targeted drugs, smart drugs, but even phytotherapeutics. These are natural integrative agents that can adjunctively support the body, work in tandem on the miRNA components, which stop some of the epigenetic signaling in tumor microenvironment, but also in some cases even augment the chemotherapeutic benefits while reducing the side effects and strengthening the body's immune system. Really next level care. So this isn't typical chemotherapy or radiation, it's GTFC. Thank you for joining me, and may God bless you on your journey to healing.